Hi, thank you for joining us today for Journey Through the Milky Way with Jacqueline Huxford from the Oklahoma Breastfeeding Resource Center. Sorry, I always get tongue-tied whenever I say that all together. So just sharing some great information with us today about breastfeeding and all the different resources and things to expect and what have you. So really appreciate you guys joining today. And Jacqueline, I'll let you go ahead and take it away.
All right. Well, thank you, Lindsay, and good morning, everyone. Like Lindsay said, my name is Jacqueline Huxford. I'm a registered dietitian and a board certified lactation consultant, and I work here on the OU campus with the Oklahoma Breastfeeding Resource Center. I know that's a mouthful. And I think, oh, I have the slides. Excuse me. I was doing a presentation yesterday that I wasn't in control of the slides. Excuse me. I do want to say we are a small group. I see that. So please feel free to ask questions. That's what this is meant for, is to get you guys some sound information regarding breastfeeding, and just to answer some questions that you may have. Okay, so I don't have any financial interests or arrangements with anything. So that's my disclosure. And then we always try to be inclusive, especially when talking about, maternal and infant health. I may use the word mother or families, but I do understand that, people identify in different ways, and that's fantastic. So I always try to be aware of that and sensitive to that. So don't want to offend anyone if I use the word mother, if you may identify as a parent. Okay, so these are our quick objectives that we're going to talk about today. The importance of breastfeeding. We're going to talk about some of the laws that protect families when they are breastfeeding in the workplace and pumping, and then some breastfeeding resources around the state of Oklahoma. And then we'll talk a little bit more about what to know and to be prepared if you are going to be pumping at work. What are the different types of pumps? How do you obtain one? All of those things. Okay, and this is our team. So we have our fearless leader, Becky Mantle. She is also the assistant or the executive director for our milk bank, which we'll talk about here in a little bit. And she also helps with the Coalition of Oklahoma Breastfeeding Advocates, which we'll talk about in a little bit. And then myself, and then Sarah Bellotti. She helps coordinate anything and everything that has to do with this office. So this is our team. And this is our website. I really encourage you guys to maybe jot this down, save it to your, bookmark bar, whatever, because there are tons of resources on here. If you ever got questions about anything, this is kind of the place to go on purpose, right? It's the resource center. So that, is very simple. Our website there, and that's our homepage. Okay, so let's dive into breastfeeding information here. So how long do you breastfeed? There may be some different, ideas out there, or thoughts or theories, or what you've heard or what you've seen. But the American Academy of Pediatrics, the Center for Disease Control, and the World Health Organization all have the exact same recommendation, which is exclusive breastfeeding for the first 6 months of life, which means nothing but breast milk or breast milk feeding. So maybe that's direct breastfeeding from the breast, or if that is pumped breast milk and then given to baby. And then continued breastfeeding while adding age appropriate foods for the first 2 years of life. So there used to be this kind of mixed message. The Academy of Pediatrics would say up until the age of 1 or longer, but the World Health Organization has always said until the age of 2. So sadly, the rest of the world breastfeeds a lot longer than the United States. There's various reasons for that. But that is, if you ever see a mom breastfeeding a toddler, just high five her. That's an amazing thing for both parties involved, the mother and the baby. Okay, so those are the recommendations. So why is breastfeeding important? So these are a few things that can help for the child. So if a baby receives breast milk, whether directly or through a pumped and through a bottle, they have a lower risk of all of these health issues, right? So they have a lower risk of obesity, diabetes type 1 and type 2, asthma, anything to do with the gut. So breast milk is going to help colonize the infant's gut. those first, crucial months of their life. With that being said, of course, it's going to have lower risks or instances of Crohn's and ulcerative colitis, which are both autoimmune disorders that affect the gut. They have less cases of respiratory and ear infections. Not to say that breastfed babies can't get ear infections. That does happen. However, they may be less frequent or less severe if they're breastfed. Helps prevent childhood cancers, and then also SIDS, so sudden infant death syndrome. Um, breastfeeding actually helps reduce that because it helps the baby stay in a more active sleep state throughout the night. Not to say that the breastfed baby wakes up more. That's not quite what I'm trying to say, but it just keeps their brain more in an active state versus falling into that super deep sleep, which is what research has shown that when we do have these cases of sudden infant death syndrome, that the baby may have fallen into that deep sleep and then something else happened and they couldn't wake up. So breastfeeding does help reduce that. For preterm babies, if you happen to have a preterm baby or know of someone that did, the breast milk is extremely important. It helps prevent all of these things or help reduce the rate of that. So necrotizing enterocolitis, also known as NEC, it's a very scary, very uncommon, luckily, thing, but basically parts of the gut start to die. Breast milk has been significantly shown to help almost like not allow this to happen if the baby's getting breast milk. Brain development, sepsis, their eyes, SIDS again, longer stay in the NICU, and then hospital readmission. So really want to focus, if we do have a NICU baby, supporting those moms because they're going to be pumping and getting them the best support that they need to get that milk to their baby. And impact is dose related. So basically, the more milk that they're going to get, the better off they're going to be. And that's for anything. So I always tell families, whether you breastfeed for an hour, a day, a week, a month, a year, it counts. Okay. It's important. Anytime we get that milk to that baby, it's important. Okay, so what about the mom? So there's two people involved in breastfeeding, right? You've got the breastfeeding parent and you've got the child. So for women or for that are breastfeeding, they have a less risk of all of these things. So breast cancer, ovarian cancer, postpartum depression, cardiovascular disease, which is the number one killer amongst women. So breastfeeding can help reduce your risk of having cardiovascular disease later in life, or it may not be as severe. Postpartum weight retention. So we do burn calories when we are breastfeeding or pumping. So it helps kind of get our bodies back to that pre-pregnancy weight. Rheumatoid arthritis, which I've always thought was fascinating, has to do with the hormones. It helps regulate our hormones when we are breastfeeding our children. And it kind of helps just the whole body recover from delivery and move on to the next stages of life, if you will. Okay. So this was a study, it's a little old, but it's still really good. So it was done about 11 years ago, and it looked at reasons why families did not breastfeed as long as they wanted, or why they stopped breastfeeding, and for whatever reason. The saddest part of this study was that 60% of those mothers stopped earlier than their own goal. So let's say your goal was, I'm going to breastfeed for the first 6 months, and maybe they made it 6 weeks. I'm going to breastfeed for the first year and I made it 6 months, whatever the case is. And these were the reasons that they said they ended up stopping. Difficulties with lactation, infant nutrition or weight. The mother was ill and had to take a medication and she was told she had to stop breastfeeding, or the effort of pumping, or maybe not having the support when pumping when they went back to work. So we're going to talk about things to hopefully not let this happen today. Okay, a question we get a lot, which I haven't mentioned yet. I also manage our breastfeeding hotline, which we'll talk about here in a little bit. But a question we get a lot, especially now that we're kind of getting into that really fun time of year where everybody gets sick, is can you breastfeed if you're sick? Yes, you can. The beautiful thing about breastfeeding when a mother is sick is that if I have a cold and I'm breastfeeding my child, I am going to start building up immunities to whatever cold I'm fighting, and it's going to be in the breast milk and then given to baby, so their baby gets that immunities to help fight off whatever mom has. So it's just kind of the most protective thing you can do during cold or flu season. So yeah, cold, the flu, or COVID, heaven forbid. So this is a little bit on COVID. Luckily, we're kind of coming out of this, but you can breastfeed if you have COVID. Heaven forbid that happens. You're going to feel miserable, but you still can breastfeed. Just get some support people, if you will. Just wear your mask if you need to wash your hands, all that, but it is safe to continue to breastfeed your child directly. You can pump if you choose to and give it to your baby that way, but you can directly breastfeed if you have COVID. Okay, so I mentioned this a second ago. So every state is going to have a breastfeeding coalition, if you will. So here in Oklahoma, ours is COBA, which is Coalition of Oklahoma Breastfeeding Advocates, which is a mouthful. So COBA. So this is the organization that helps kind of fight for breastfeeding rights and all those things. They have helped pass a lot of laws that maybe you're not aware of or maybe don't directly affect you, if you will, and what you do or where you work. But they have been a fantastic organization here in the state of Oklahoma. So this is their website. So a few things that they've helped do. So these are some of the breastfeeding laws. You are allowed to breastfeed your baby wherever you are. What I always like to say is if you're not trespassing, then you're allowed to breastfeed your baby, right? If you're trespassing, it's a different story. Then you and your baby have to leave, whether you were breastfeeding or not. So, you can't be legally asked to leave if you were breastfeeding. We sometimes still hear about this. We had an instance recently at the Tulsa State Fair. A mom was asked to move where she was breastfeeding, which is just devastating that this day and age it still happens. A lot of places have nursing rooms, which is awesome, but a lot of places don't. You don't need to breastfeed in a bathroom. If someone tells you that, probably lack of knowledge. It'd be like asking you to prepare lunch in a bathroom, right? So not every place is going to have a place for you to breastfeed, but they can't tell you to go to the bathroom. So these are some laws. You can look these up online. Break time for public school employees. This is one of our newer ones that was passed here in Oklahoma in 2021. Some of the hardest professions that have, trouble with pumping while at work is our teachers and nurses, obviously due to the demand of the job, right? So we've really tried to combat it, or not combat, but try to advocate for these professions and get them better help. So the break time for public school employees was a big thing that we passed in 2021. I think this talks a little bit more about that. So yeah, that one was signed into law in 21. The Pump Act, which is national, which was a huge deal. So the break time for nursing moms was implemented, I don't know, was that 2010? But it kind of had some gray areas. So there were a lot of professions, which is why I love this infographic, that kind of were left out of that. Nurses being one of them, teachers. So where are these, professions supposed to go when they need a pump for their child? So this act, which was federal, helps protect these professions so they can, it is law that they are allowed break times to pump milk for their babies. So that is huge. So you're protected by law. So if you ever have any issues in this, let us know. We'll fight for you. Okay, this is another great resource, if you will. So the Oklahoma State Department of Health, they have tons of breastfeeding information. So this is their website. So if you have, need anything else, you can go there. They have a lot of the laws as well. In addition to COBA's website, they're going to list all the breastfeeding laws. Okay, so I mentioned briefly that we have a milk bank. So what does that mean? So the Oklahoma Mothers Milk Bank is a nonprofit, and what they do is they take donor breast milk from healthy moms and babies that have extra milk, and they would like to donate it. And this milk is then pasteurized, if you will, but it's not taking away anything negative out of the milk, and they're not pasteurizing because the milk is bad. But it's more, kind of, making sure it's free of, any harmful bacteria, if you will. And then it is mostly given to our NICU babies. Across the state of Oklahoma. And actually, we help the state of Kansas because their milk bank closed during COVID. So we actually help Oklahoma babies and Kansas babies. There aren't as many as you would think in the US, which is baffling to me. I spoiled. I came from Texas. I worked across the street from a milk bank when I was down there, and then I moved here and we had a milk bank. So I just thought everybody had one, but they don't. So be proud of your state that we have this amazing resource for those that very vulnerable population of NICU babies. This milk is life-saving, and the families that donate their milk are just amazing beings, and it's an incredible thing. So this is our new location. We're very proud of our new milk bank. We have a fantastic facility. That you can see there, that mom and that little boy there, that was all the extra milk that she had. That's not normal. I don't show this to say that you need to have all this milk stored in your freezer. That is not the case. There could have been a million reasons why she had this milk. But regardless, she, out of the kindness of her heart, donated this to other babies, which is amazing. So there's their website. You can just Google Oklahoma Mother's Milk Bank. There's, yeah, okmilkbank.org. And then there's their phone number if you have any more questions about that. Okay, so if anyone is expecting currently or knows someone that they're expecting, this is a fantastic resource. It's on the homepage of our website. So if you forget this slide, you can just go to our website. But it is a online, free, interactive little prenatal education, if you will. Yes, it kind of focuses on breastfeeding, but it's more of why is breastfeeding important and what's going to happen once this baby gets here? What's normal baby behavior? What is rooming in? What is skin to skin? What are some resources that are available to me? What is normal crying? What is not normal crying? Why does my baby wake up so much? All those things. So it kind of goes through that. There's some good videos in there. It's fully in Spanish as well. So that's why you see the two graphics there. Highly encourage you to use this. You can do it on your cell phone or on your computer. And then this is our hotline that I kind of mentioned. So another thing that you should be proud of Oklahoma for is that we were the first in the nation to have a fully functioning, free breastfeeding hotline, if you will. And it is staffed 100% by board certified lactation consultants. So when you call this number, you will get a trained professional in this area that can answer any and all questions. We do have a bilingual, she speaks Spanish and English person on our staff. You can text the hotline as well, in addition to phone calls. And we've, said, been around for 15 years. Okay, so here are some of the common reasons that we get with the hotline, and you can kind of, answer in the chat or answer to yourself what you think might be the most common. It's kind of a trick question. It varies. 1 month it's, medication safety, especially during flu and cold season. Sometimes it's milk supply questions like, I don't feel like I have enough milk. What can I do? Sometimes it's, questions, where do I get a breast pump? How do, my breast pump's not working, whatever the cane is, whatever the question is. So here is kind of an example of what you will see when you text the hotline. So our keyword is OK2BF, and it's the number is 61222. And this is our little welcome or intro text. And we have it again in Spanish. That's why you see it there. Welcome to the hotline, and then it says it in Spanish. And then you have the option to press 1 or 2 for your preferred language. And then the other question or auto text that you will get is this kind of, we call it a screener question. It's really to kind of, if there is an urgent issue, we want those people to call. So it's kind of just not to weed those people out, but to get those people to help faster. So if you press no, it's not an urgent issue. And then that is the last auto text message you will get. The next time someone talks to you, it is a live person answering your question. So here's just, kind of something generic. This is my phone number, so no HIPAA issues here. So can I take a Benadryl while breastfeeding? And yes, you can. It is safe while breastfeeding. So if it's just a simple question of that, if it's a more in-depth question, that's fine too. You can text that or you can still call. We love the texting, and I feel like our families love it too because we can send resources a lot easier. We use a lot of evidence-based YouTube videos. One positive benefit of YouTube. So for instance, there's a neonatologist out of Stanford University that's also an IBCLC, and she has fantastic videos. They're old, but oh my gosh, they're good. So we send those all the time via YouTube. Hey, I know I'm not in person, but watch this video. It's kind of got some, pointers for whatever you may be having trouble with. Okay, so here's what it would look like if you said, yes, this is urgent. So you can see right there, we're like, hey, call. Because our staff will answer an urgent message immediately. So that way we make sure we can get you some help. If it's 2 o'clock in the morning, people aren't texting. I mean, I wouldn't be texting. They're calling, and we answer the phone call at 2 o'clock in the morning and get these families the help they need. But the beauty of the texting is, say, if you did call at 2 o'clock in the morning, the next day, I can be like, hey, we spoke in the middle of the night. I just wanted to follow up and see how everything's going. And families really like that too. So it's a beautiful thing to have both phone calls and text messaging with the hotline. Okay. So the Baby Friendly Hospital Initiative. If anyone knows what that is, you get a gold star for today. But basically, what this is was an initiative started with UNICEF and the World Health Organization to help give moms and babies the best possible care during that period of delivery. So there are 10 steps, if you will, of things that hospitals follow. But the biggest things are skin to skin, keeping baby and mom skin to skin, because that just helps get everybody off to a better start. It helps regulate the baby's body temperature, their blood sugar, their heart rate. It's bonding. It can help breastfeeding. Rooming in is another thing. So kind of, what you would see in TV is, the room of all the babies in a nursery and everyone at the window. Those really don't exist anymore for a reason. We want the baby in the room with the mom, right? So they can learn baby's cues. They can get to know baby, kind of figure out how things work because it's all new, right? So that's another key part of baby friendly. And another part is education. So making sure that the hospital staff is educated on all these things, how to help give parents an informed decision about how to feed their baby, whether that's breastfeeding their baby or if they choose to formula feed that baby, what is the best and safest way to go about that. So here is our map of Oklahoma. And you can kind of see the stars obviously are where there is a baby friendly hospital. We are currently working to get more. We just got a grant and we're very excited about that. So hopefully here in maybe the next year or two, there will be a heck of a lot more stars on this map. I assume most of you people are metro located. So just, you can focus on where we are here in the Oklahoma City area. But we have several. So we've got what? OU Children's is baby friendly. Integris Baptist is. Where is it? St. Anthony's is, and then there's another one. Canadian Valley is also. And then what is that? 11 Shawnee is, and then Duncan. So those are kind of, well, Duncan's further, but kind of gets you an idea of where, if anybody's from the Tulsa area, Hillcrest is in Claremore. Of course, that's not quite Tulsa, but in that area. Okay. So something we're proud of. Oklahoma, of course, has not the best rates when it comes to anything health related, but we actually here in Oklahoma have a higher average or percentage of babies born in baby friendly hospitals than the national average. So that is something to be proud of. Even though it's a low percentage, I think the national average is like 28% of births are done in a baby friendly hospital across the US, and we're at 35. So very proud of that. Okay, so what support is out there after discharge? So these are some different programs out there, or just options for resources, if you will. So outpatient lactation at your hospital that you delivered at. There's still the La Leche League, which is kind of the first ever lactation support that existed. They're still around. They're still fantastic. We've got the hotline there. If you qualify for the Children's First Home Visiting Program, which is through Medicaid, it is fantastic. We also have the WIC program, which is also fantastic, and they have breastfeeding peer counselors. And then, of course, we've got COBA there, the Coalition of Oklahoma Breastfeeding Advocates. And then pumps. Okay, so here's the fun thing that I always like to talk about, because if you get pregnant and you're like, I know I'm gonna have to go back to work and I need a pump, and you're like, what do I do? I don't know what any of this means. I don't know where to go. I don't know what's good, what's bad, what's wrong. So I'm going to talk a little bit about that today. So these are all the different types of pumps out there. I always like to laugh. So the manual pump over here on the right, I feel like it gets a really bad rep. They're still fantastic. Don't ever discredit a manual pump. You can see them, you can buy them at Target, Walmart, whatever. They're in the aisle. You have your electric pumps. Most of them are going to be double electric. I think there's maybe still single electrics on the market, but most are going to be double. Where you pump both breasts at the same time. You've got the portable ones, which basically is battery operated. It still has cords. You've got your very popular wireless ones, which get all the rage these days. And then we've got our hospital grade, which are fantastic when needed if you have a NICU baby. Okay, so let's go on. So how do we get a pump? Well, you can buy one, right? Very simple. You can retailers will show you how to buy one. However, your insurance does cover a pump. Most insurance companies, if you have private insurance, are going to cover either fully cover the cost of a breast pump or they will cover a portion of that cost. If you receive Medicaid, this is crucial. If you receive Medicaid, you have to obtain your breast pump through the WIC program. So there's kind of some like, you know, unclear area there. So you can enroll in the WIC program in your pregnancy, but then you do have to recertify into WIC once your baby is born, and that's when you would get your breast pump. Okay. You can rent a pump. That's usually more for if you have a NICU baby. And then what I always like to say, please don't buy one secondhand. Please don't buy one. It just between friend sells. I see them all the time. I've got 3 kids. I love to shop those thrifty stores. Do not buy a pump for several reasons. One, you have no idea how old that pump is. Two, if it is an old pump, this mom could have used it for 5 kids and the motor is shot and you're going to have no idea. It's going to sound the same. You're going to turn it on. You're going to put it on your breast and you're like, why is nothing happening? The motor is shot. It's not going to have the same suction power as a brand new pump would because they're not designed for that. The pumps that we have for the NICU babies, this yellow looking one here, it's really old and ugly. That's a terrible way to describe it. The hospital grade one, they have a completely different motor and pump, and they are meant to last for eternity. Okay. These other ones, like this is a Spectra, for example, or like a Medela, they do not have that same motor, and they will give out. Even I've had families call the hotline, and maybe they're on baby 3 or 4 of their own babies, right? And they have been using the same pump all the way through, and all of a sudden their milk supply plummeted. And after questioning, we figured out she was using the same pump and the motor wasn't as good, but she had no idea because it sounded the same. So yeah, so if you want to get a new pump, if you can. And then yeah, WIC participants, like I mentioned, you have to get that through. Okay, here is a website, and there's another one out there called Aeroflow, and I can put that into the chat. But Edge Park Medical and Aeroflow are basically medical supply companies, if you will, and they make it the process of getting your breast pump with your private insurance very easy. Okay, you go on, fill out a couple questions. You know, I'm pregnant, I'm due, whatever. My insurance provider is this, and then it makes you put in like your policy number or whatever on your insurance card. And then it shows you, okay, here are the ones that you can get for free with your insurance coverage. And then that's all you do. So you don't have to like obtain a prescription from your doctor, which is what a lot of people hear. It's like, well, how do I do that? Then what do I do with it once I get it? This kind of makes it easy for you. If my memory's right, because it only lets you do it if you are in fact pregnant. I've tried to do it as a dummy. It asks for your doctor's name. So say if you have your insurance and then you have the delivering hospital, it'll ask like your doctor. And I assume that's how they obtain that prescription. But again, it's very easy, very streamlined. And you can pick out whatever pump is available. I think, yeah, I've got some. So this was done, I think I did this like a year ago and used the insurance here on campus, right, which is Cigna. And these were the ones that you can get for free. All great pumps. It just depends on what you need. You can get the wearable ones, which I did not have a picture of that. Like the Willow is extremely popular, or the LV, which I had a picture of right there, this wearable wireless one. You just would have, I think like they're $400, I think. And so the insurance would cover $200 of that. So then you would get it half off and you would pay the rest of the price. But it does help. Okay, so what do I do? I've got this pump. I've had my baby. I'm ready to go back to work. Well, what do I do? So I get this question a lot. If you know you're going to be out for 8 weeks, okay, or 10 weeks or 12 weeks or whatever. So let's say 12 weeks. At about 10 weeks, this is when you want to start pumping. I would say about once a day. So say we don't really have routines with babies, not at that age anyway. So let's say, first thing in the morning, once you get up and get going, maybe after you fed your baby from your breast, I would pump for 5 minutes. Do that every day for say 7 days. And then you have a little stockpile in your freezer to give you that peace of mind when you do go back to work on that first day. When you are with baby, even after you go back to work, you want to feed at the breast as much as possible. And the reason for that is that if you have an effective baby feeding at the breast, they are better for your supply than the pump is. So the way that the baby eats at the breast is obviously different than the way a pump will extract the milk from the breast. So the baby has the whole mechanism of their jaw, their tongue, their chin. There's a lot of things going on there. A pump, right? It's just push and pull, push and pull, push and pull. And the bond, right? There are hormones released when you have baby next to you. There's oxytocin for the mother, for the baby, all those things. So still try to feed baby when together as much as you can. And then when you are at work, depending on your work schedule, let's say you work from 9 to 5. You feed baby at home before you leave for work. Maybe you pump a little bit before you leave from work or leave for work. You get to work. Maybe you pump at 10 a.m. Then you pump at lunch at like 12:30. And then maybe you pump at like 3 p.m. And then you go home at 5 and then you feed your baby when you get home. So you're pumping at work maybe 3 times during that day. Also, which I think is my next point. So when away from baby, pump every 2 to 3 hours, depending on the age of the baby and the schedule. So how long to pump? I have people tell me all the time, well, I pump for 30 minutes 4 times a day or whatever the case is. Pumping for more than 15 minutes doesn't really do your milk supply any better, if you will. Again, the pump is different than the baby. So, and that's a waste of time, right? Because if you're pumping for 30 minutes, you gotta get in the room, you gotta take your shirt off, you gotta get the pump out, you gotta get it plugged in, you gotta get set up. Then you sit there for 30 minutes. Then you gotta take the pump off, put your clothes back on, put the pump together, and then go. And then by the time you're done, that's like 45 minutes. When you may or may not have gotten any more milk than if you would have pumped for 10 to 15 minutes. So that's kind of, maybe when you're starting out, when you're at home, kind of building up that supply before you go back to work, I would start with 10 minutes. And then if you need to at work, maybe do 15 minutes. If you get busy, because it happens, and 5 hours has gone by and you have not pumped yet, you may have to pump a little bit longer. But if you know, okay, I'm not going to get a break to go sit and pump for 30 minutes or 10, 20 minutes, whatever, but I have 2 minutes right now. This is when those manual pumps are life-saving. So you can pull out your manual pump, which doesn't require any assembly, and you can pump for maybe a minute on one breast, a minute on another breast, save that milk, and then go on. And then when you have that time to sit down, pull out your electric pump and, double pump. What happens is that helps your milk supply and it gives you some relief. So never discount what pumping for a minute or two, literally 60 seconds or 2 minutes can do for your body and for your milk supply. And then pumping duration, I mean, it's however long your breastfeeding journey is, right? Now, obviously, as baby gets older, they don't nurse as often, therefore you won't have to pump as often. So let's say if you're still nursing your baby and they're 1 year old and you still work full time and you're away for 8 hours, you would probably pump maybe once, maybe twice while you're away from your baby because the baby is older, they're eating foods, they're still nursing. So it's not the same demand, if you will, that when you're pumping for like a 2 or 3 or 4 month old when you're at work. Okay, so where should I pump or when should I pump? When your breasts feel full and around the time that your baby would normally eat. Where should you pump? So obviously we are all OU HSC employees here. We have a map. I think it's on the website, I know, but I haven't linked it. It's changed. Ask your supervisor because they're going to know, depending on where you are, where to go. And again, by law, they have to give you that. If you have any pushback on this, please let us know and we can help you. But there are many places around campus for you to safely pump. If you happen to have an office like I do and the door shuts and you happen to have a fridge in your office, I don't know why it's in here, but I got one. You can obviously just pump in your office and shut your door, and have that open communication with your coworkers, hey, I'm going to be pumping when I come back to work after I have this baby, just, let them know if you see this sign, we can pump, if you need something, just, yell through the door or send me a message on, Teams, whatever. Just have that communication. It's all up to your comfortability, but then two, you are protected by law to be able to do this for your baby. Let's see what else. And then storing your pump. So this is something, if you don't have a mini fridge like I do, which again, I don't know why it's in here. If you don't have that access to a fridge, or maybe you don't feel comfortable keeping your milk in a fridge where other people keep their lunch, all you can do is just get you some freezer packs, from Amazon, and then get you a lunch box. It will stay safely in that until you can get home and put it in your fridge at home. There is nothing wrong with that. The milk is not going to go bad. It is completely different than formula. Breast milk is honestly safe at room temperature for up to 6 hours. So I say that again, if you are at home and you do pump in the middle of the night for whatever reason, and you fall back asleep and then you wake up and you see this milk that you left out, it's okay. Don't throw it away. You can give it to baby right away, or you can put it in the freezer or fridge. Okay, so yeah, my next guide. So here's the CDC's breast milk storage guidelines. You can print these out. This one's old, but they haven't changed. So it's just, it can stay room temperature. What is their recommendations? I don't even remember. I've read. It doesn't have it on this one. Is it on the next one? Anyways, it's 6 hours. So freshly pumped milk in your room temperature, if you keep your house at anywhere from 70 to 74, it's fine. In the fridge, it's good for about a week, 5 to 6 days, if you will. I think it says what, up to four days in the fridge. These are very conservative. Obviously, they're the CDC. In the freezer, it's good for up to 6 months. If it's a deep freeze, it's up to a year. The reason why that's different is if it's the freezer in your refrigerator, you open it all the time, right? So it's not a consistent temperature as much as a deep freezer would be. Once you thaw the milk, it's good for 1 to 2 hours. So what I always tell families is only thaw it as needed, okay? And then when you're storing the milk, you want to label it with the date, obviously, that you pumped it. Store it in the back of the freezer. Freeze milk in small amounts, so about 2 to 3 ounces, so that way you don't waste any. So say you thaw out 2 to 3 ounces and baby eats all of it, that's fine. Then you maybe want to thaw out another 2 to 3 ounce bag, but don't thaw out two 2 ounce bags at the same time in the event that baby doesn't eat it and then you have to use it or throw it away. Milk also can be stored, like I mentioned, in a travel bag. So here's just an example of, someone's at work, they're pumping, there's my milk, and then I've got to store that. This is not normal, by the way. Not everyone is going to pump this much milk in one setting. I think from this photo, if my memory's right, this person had twins and had waited, like had got really busy at work and had to wait a while before they could pump. So I think that they sent this like, oh my gosh, look at this. Anyways, so here are the milk storage bags. You can get them anywhere. No brand is better than the other. This is just the Lancino brand. I think you can get them at like Target or Walmart. But they lay flat that's why they're kind of designed that way. So when you put the milk in there and you lay it flat and you freeze it. So when you thaw it, what you can do is just get like an insulated cup, like a Yeti or a Stanley, put some warm water in there, dip the milk in there, let it thaw, give it to baby. It's fine. You can buy a bottle warmer if you choose. I think they're a waste of money. You don't really need all these fancy things. You can also just do it under running water, under warm running water. This is not a chicken breast. That is safe. I mean, it's not safe with a chicken breast, but it is safe with milk. You can do it that way. Another tip as well is that breast milk does not have to be warmed up to that, body temperature to give to baby. If you can figure out a way to get your baby to take cold breast milk, your life will be so much easier for the time that you are breastfeeding and feeding bottles or whatever the case is. It is completely up to the baby's preference. The milk is not bad if it is cold. It is not bad if it is warm. It is all the baby's preference. And you will find, obviously, every baby is different. But I always like to give that, because you may be out and about, you've got some frozen milk in your diaper bag, and then you want to give the baby the bottle, whatever the case is, and then you have nowhere to warm it up, or you're traveling in a car or 8-hour car, whatever the case is. So, you may just try some cold milk and see what happens, and they may take it, they may not. It doesn't hurt anybody. Never put it in a microwave. That kind of goes for formula as well, because it can cause hot spots. And then with breast milk and even with formula, it can damage some of the nutrients when we put it in the microwave. So we don't want to do that. We want to make sure that those methods I talked about. So running it under warm water in the sink, or they're putting it in get some warm water into a cup and then just setting it in the cup. And then never refreeze milk that has been thawed, because it's not, it could have the chance of, growing bacteria. So that's why, I really stress you don't want to thaw out more than you need. You want to thaw as you go. Okay. All right. So let me see what my next slide is. And then how do I feed the milk once I get it into the bottle to the baby, right? Pace bottle feeding, it is a thing. You can YouTube video that. It's as simple as you just have the bottle more kind of level, if you will, versus like, you think, oh, I'm going to feed a baby, I've got the baby, I'm going to shove the bottle in their mouth and they're going to eat. Yes, they will eat. But with a breastfed baby, when they're at the breast, they control that flow of the milk, right? They have kind of control over that versus a bottle. They don't have that control because it has a hole in the teat, right? So if you tip a bottle upside down, milk will fall out of it. So that paced bottle feeding is going to kind of help them regulate the intake of the bottle a little bit better. So let's see. Yeah, milk can be served cold, room temperature, or warm. To heat it, you can just put it under running water. Don't heat the milk directly on the stove or the microwave. You can obviously test the temperature before, make sure it's not too hot. Um, Breast milk also will separate a little bit. That's normal. It's just, it's not, it's kind of like, cow's milk when it's raw, it separates, right? The milk is the fat in the milk will separate a little bit. Just swirl it a little bit, mix it back up. It is not bad. It has not gone bad. It's just what it does. Okay. So if put milk in the fridge and then you come back an hour later, you're like, oh my God, what happened to it? It's normal. Just swirl it up. You can shake it a little bit, and then give it to baby. And then if the baby did not finish the bottle, I can't read what that says. My thing is on the way. Hold on. I don't remember my last. Oh, well, y'all can read that. What is it? Leftover milk must be used within 2 hours. Okay. Okay, so here's paced bottle feeding. Here's kind of a better graphic than what I was describing. So hold baby in the upright position, allow baby to pace the feed, and then respect the baby's feeding cues, right? If they're acting like they're full, then don't try to make them finish the bottle. That may be all that they needed at that time. Another thing too, a question we get is, I've done nothing but directly breastfeed my baby for 6 weeks now. I'm going back to work at 12. How do I offer them the bottle for the first time? If you can have someone else offer them a bottle, maybe not mom, and maybe do it in a different location than you usually nurse. Like say you always feed your baby in the same chair in the same room, and then now someone's come in and they're in the same chair in the same room and they're trying to give them a bottle. The baby may be like, I'm not doing this. So just mix it up, maybe put them somewhere different, maybe a different room, maybe mom walks outside, whatever the case is, get creative. Some babies, not a problem. Some babies, they're, what's happening, they get a little aware of the situation. But these are questions we do get on the hotline when families are preparing to go back to work. Okay, and my next, and this a little bit more about that. You have the protected break time to pump. It cannot be a bathroom. It needs to be a shielded area free from intrusion. For an electrical outlet, a chair to sit in, all those things. The beauty of that is where we work here, we have all of these things. Again, if you have any issues with this, please reach out to us and we can help you work through that. Also, OUHSC is what is it? A baby friendly, breastfeeding friendly work site. I should know I signed these certificates, which is great. So you work in a fantastic place. So that's kind of what this is talking about. If you know of someone else, maybe somewhere a friend works, a family member works, and they also do this as well. Maybe they're not recognized. Let us know. We'd love to recognize these places because it is a beautiful thing to be able to help your coworkers and employees achieve that goal to feed their baby. Okay, our last thing, which I want everyone to sign up for this if you can, my two people on here. If you have your phones out, please scan this QR code. Obviously, if you're expecting, even if you're not, if you've already had your baby, whatever the case is, this is something new that we've started to help be a little bit more proactive with the hotline. So this is a way to kind of, I hate saying sign up or enroll, but basically it sends you like a welcome text from the hotline that just says, hey, we're the hotline. And it's going to send you a link to that prenatal education that I was talking about. And then the only other text message that you get is around your estimated due date. And it just says, hey, we're the hotline. We're just checking in. And that's it. So it's there, it's in your phone. If you have questions, it's right there. If you don't have questions, no harm, no foul. We're only going to reach back out to you if you ask us a question, but at least you have that kind of resource right there in your phone. So yeah, that is our only update. Like I was telling Lindsay at the beginning, is something we've added. And then we do have some time for some questions. Anybody's got any questions today?
Absolutely great information. Well, if we kind of give people some time, if they're throwing a question or so in the chat, um, I know you don't really get a guidebook if you are a new mother and decide to
Yes.
breastfeed. That sometimes there's challenges and you don't know what's normal and what's not normal. So I think this is great information and really helpful to share with anyone and everyone that all these things are perfectly normal and that there are these resources available to ask these questions, and no question is a silly question or anything like that. So I really, really appreciate this information. The slides, Jacqueline, it's completely up to you if you want to share the slides, but I will be,
Yeah.
the recording will be available to as well. And if Jacqueline is comfortable with sharing the slides, she can send those to me and I'll make sure that attendees receive those as well.
Yep. I can absolutely share the slides, so not a problem.
Fantastic. Well, I think that was the only question that I saw filter through. So again, appreciate your time. And yes, I think even if you're not someone who's expecting great information, just to be aware of, even to share with coworkers or have that awareness. If you have a coworker or friend that does go back to work or decides to breastfeed or any of that information, you have
Or
this.
if they're unfortunately having any issues pumping at work. It does happen sometimes on
Yes.
campus. Obviously, we're a very large campus, so yeah, have them reach out to us, and we can help. We can help them navigate whatever it is.
Yeah, and of course, Jacqueline, actually, we have, of course, employees not just at our Health Science Center campus where your office is located, but also with our Norman campus
Mhm.
and our friends up on the OU Tulsa campus too. How can you guys assist with employees at those different campuses or people in those different areas?
So we can just help advocate for them. Like I said, they are protected by law to have the time and the space to pump, and especially since I know it's the HSC campus is a baby friendly or breastfeeding friendly work site, but we would just maybe go to battle for them if they didn't feel comfortable doing that, and seek out. Okay, there has to be a space for them to have time to pump, regardless of what their position may be. So. We know Kobo very well. We work very closely with them, and that's what they're all about. So,
Excellent. And another question did kind of come through. So beyond the Mama Vaz, so there's some of those kind of portable stations that are up in like airports and what have you,
yeah.
different spots. Do you have suggestions for pumping moms that travel a lot for work to find places that are not the car near where they are? So I encourage people, like, especially if you're going to a conference or something like that, to check in with the people coordinating the conference beforehand to try to get that information if they don't provide it up front. Do you have any other suggestions?
That's a great one because that is something that most conference centers are going to have a space for you. And like I said, if you reach out beforehand, or even if maybe you forgot, I would just go find whoever's in charge of the conference and ask them where you could go. Um, and as you know, bathrooms are not suitable. If you're in a bunch of hotels, sometimes hotels have spaces that's for their employees. So say maybe like you're at a conference at a hotel, but you're not staying at a hotel or whatever the case is. I know the car, it's not a fun place to pump, but sometimes that is, I hate that. But it is an option, and some women hate it, some women love it. It just don't do it while you're driving. But it's not a realistic option. I'm trying to think what else. Maybe if you are somewhere and there are offices, and maybe I don't know, you could ask, if you could borrow someone's office if you happen to know that person, because you just need somewhere where you can shut the door and have an outlet, right, where you can shut and lock a door and have a chair. But that is if I mean, and if you need more, whoever this is, just reach out to me. If I know some more logistics, I could help you out. But yeah, the mama vans in airports, sometimes just, a lot of places have these, especially newer facilities. Like, I mean, the Dodger Stadium here in Oklahoma City has a nursing room, but some don't, some do. You just have to kind of figure that out. Sometimes just a little research beforehand, or when knowing who to ask when you get to wherever you are that would know where to send you. So,
Yeah, I would say, places are continuing to get better
Yes.
about having a spot. Like you go to the state fair or something like that, they will have many times you'll find that they have a spot. But yeah, I know sometimes it can be challenging. I would say just don't be afraid to ask.
Mhm.
Excellent. Well, again, Jacqueline, thank you for your time and everyone else for joining us, and have a wonderful rest of your day.
Wonderful. Thank you guys.